Is your doctor adding blood pressure medicine after blood pressure medicine to your regimen and you're tired of it? Or maybe you're on a blood pressure medicine and you want to lower the dose of it or come off of it completely. Or maybe you just want to learn about natural ways to lower your blood pressure. If so, then this video is for you, as we're going to discuss 5 natural ways to lower your blood pressure, the last of which is the only over-the-counter device that's FDA cleared to lower your blood pressure, and it's one you're probably not familiar with, so stay tuned. Greetings, this is Brandon E., your Pharm.D, and welcome to my YouTube channel. Before we jump into the 5 ways to lower your blood pressure, I have to give a disclaimer. If you're on blood pressure medicines, never stop them or lower the dose on your own without first talking to your healthcare provider. Certain classes of medicines like beta blockers can cause an unsafe rise in blood pressure if they're stopped abruptly, putting you at greater risk of heart attack and stroke. But if you do the things we talk about in this video, at the very least, your doctor will be able to lower the dose of one of your medicines, and at the very best, you'll be able to come off of your blood pressure medicine. Now let's jump right in. The first method we're going to talk about to lower your blood pressure is through regular exercise. Regular exercise makes the heart stronger, allowing your heart to pump more blood with less effort. This decreases the force on the arteries, thereby lowering blood pressure. Studies show that regular exercise can lower your systolic blood pressure, or the blood pressure when your heart contracts, by 3 to 6 millimeters of mercury. And it can lower your diastolic blood pressure, or the blood pressure when your heart relaxes, by 4 to 12 millimeters of mercury. It generally takes about 1 to 3 months to see the benefits of lowering your blood pressure from regular exercise, but the benefits generally last as long as you continue to exercise. So how much exercise should we get? CDC recommends that adults get at least 150 minutes of moderate intensity exercise a week. And you can break this up and do 30 minutes 5 days a week. You can do 22 minutes every day, or whatever combination works best for you. In addition to this, it's also recommended to do at least 2 days of strength training, which can also have positive effects on the blood pressure. The next natural way to lower blood pressure that we're going to talk about is through weight loss. Weight loss is one of the most effective ways to naturally lower your blood pressure. When you're overweight, it puts an added strain on your heart. And when you lose this weight, that strain is removed. It's estimated for every kilogram of weight you lose, or 2.2 pounds, this can lower your blood pressure by 1 millimeter of mercury. So if you lose 11 pounds, you may see a reduction in your blood pressure by 5 millimeters of mercury. If you want to learn more about losing weight or how to lose belly fat, check out my video, which I'll link at the end of this one. And if you're benefiting from some of the natural ways to lower your blood pressure that we're talking about, or you have some tips that we haven't talked about, let us know in the comments so that other people can benefit from your testimonies. And if you're enjoying the content on this channel, be sure to subscribe. Now, the third way to lower your blood pressure naturally that we're going to talk about is getting enough potassium. Potassium lessens the effect of sodium in the body. The more potassium you eat, the more sodium you lose through urine. It's recommended that most men get about 3,400 milligrams of potassium per day, and most women need about 2,600 milligrams of potassium per day. So where should we get our potassium from? The best place to get your potassium are foods. Foods that have a lot of potassium include certain fruits like oranges or bananas, certain nuts like cashews or almonds, and certain vegetables like kale or sweet potatoes. You can also get them from potassium supplements, but again, it's better to get your potassium from foods. If you do decide to take a potassium supplement, make sure you talk to your doctor or pharmacist, especially if you're on certain blood pressure medicines called ACE inhibitors, which can cause a condition called hyperkalemia, which means the potassium levels in your blood are too high. The fourth way we're going to discuss to lower your blood pressure naturally is by getting enough sleep. Most adults need around 7 hours of sleep per night. And when we sleep, our blood pressure decreases. So if we're not getting enough sleep, our blood pressure is staying elevated for a greater amount of time. If you're having trouble sleeping, try setting a regular sleep schedule, as in going to bed and waking up at the same time every day. And make sure your bedroom is cool, dark, and quiet when you sleep at night. So now the final method that we're going to discuss to lower your blood pressure, and this is a product that's available over the counter, and it's the only OTC device that's FDA cleared to lower your blood pressure, and that's through the use of respiratory therapy. Respiratory therapy is a device that uses guided breathing to lower your blood pressure, and it comes in three components: a main computerized unit, earbuds, and a breathing sensor. The breathing sensor is placed around your waist and it analyzes when you inhale and exhale. This is then transformed into guided tones, which gradually lead you into prolonged exhalation. This is thought to relax constricted blood vessels, thereby lowering blood pressure. Respirate can be purchased online at www.respirate.com or it can be purchased on Amazon. The prices generally range from $350 to around $490. Now you're probably thinking, why would I buy this respiratory device that just uses breathing to lower my blood pressure when I can buy a Fitbit or an Apple Watch and they do the same thing and they come with a lot of other features? And that's a good question. I believe that smartwatches are the wave of the future, as you basically have a health hub on your wrist. They can monitor your heart rate, they can monitor your oxygen saturation, they can monitor your sleep, they can do all types of helpful things. But all of the breathing exercises aren't FDA cleared. And with respiratory therapy, the goal is to get you to 5 to 7 breaths per minute. So if you do want to try one of the Fitbit or Apple Watch apps to lower your blood pressure through breathing, you want to make sure you get to this therapeutic zone. And studies will come out in the future where the Apple Watches and the Fitbits, the exercises on them can lower your blood pressure. But I just wanted to let everyone know about respiratory therapy to let you know it is an option and a fairly good option. But if you can't afford the respiratory therapy device or you can't afford a smartwatch, do the other four things we talked about to lower your blood pressure naturally. Save up your money, and then when you have enough money, you can purchase one of the other devices. But again, if you do the things we talked about in this video, at the very worst, your doctor will be able to lower one of your blood pressure medicines, and at the very best, you'll be able to come off your blood pressure medicines. This is Brandon E., your Pharm.D. Remember to drink water and hope this video helps.